Today we are going to see respiratory problem. Before going to see any respiratory problem in medical surgical nursing, you have to review the anatomy. The respiratory system starts from the nasal cavity to the alveoli. If you see the nasal cavity, you first note it is this and then oral cavity. Oral cavity, what all the things are there, and then the tongue is there, and the hard palate, soft palate are there, and the orophagus, oral this one, oropharynx, nasopharynx, laryngopharynx, and then the larynx, and the epiglottis is the important one, and the trachea, bronchi, bronchioles, right, bronchial, and this and the important one you have to learn is called alveoli. You have to know the complete anatomical development until the child is 8-year old. The complete lung development will not present because the surfactant is an important factor for the lung development. It will develop only the 8-year age. As we have seen the anatomy of the respiratory system, each system is a very vast, studying the anatomy like medical surgical nursing. So what you can do, you can first draw the respiratory system, and as I told you, it starts from the nose. You can start with what all the diseases are coming, you can make a hint of it. If you see the nasal deviation maybe it will cause what all the cause, maybe due to nasal deviation, maybe congenital. It is about the septum which is dividing the nose, isn't it? So if it is any problem, any abnormality, it will be causing congestion, sinus infection, bleeding, or sometimes deviation will be dismantled, or it is broken by the fracture. So what you have to do, the surgical in this one will be, you will be doing the rhinoplasty. Then next one is epistaxis. Many reason epistaxis. Epistaxis will be happening, bleeding from the nose. Profuse bleeding will be coming. Sometime it is the seasonal. Due to the hot climate it will be coming. Most of the time, sometimes allergy, trauma, hypertension, chemical. Sometimes prolonged use of the nasal spray. Okay. Non-steroidal anti-inflammatory drugs which we are using. Then allergy, this one allergic, if it is coming, it's called the allergic rhinitis. If you see the signs and symptoms, sneezing, itching will be there, irritation will be there. Sometimes due to that it will be headache will be there. Then seasonal rhinitis, that's a climate changing suddenly. Then the nasal polyps. So these many problems will be coming. So if you take down the hints like this, it will be easy for you to remember it. Most of the time will not be coming as a form of a surgery. So what you will be doing, what are all the diagnosis you will be doing, maybe the allergic means what CBC report, what it will be coming, what eosinophils rate, how it will be going to be. So the allergic is continuing, eosinophil will be increasing. So these eosinophils are increasing continuously. What will be the complication? It will be end up in a COPD. This is the concept you have to understand. Right or not? Then if you see the trachea, larynx, and trachea and larynx, if you see laryngeal polyps, so what will happen? What is the main signs and symptoms of laryngeal polyps? You can just define what is the definition of laryngeal polyps, and the dyspnea will be the dysphagia, difficulty in swallowing, and then acute laryngitis. So you have to remember always ITIS. ITIS is the infections. So 21 days will be, it will take for resolve this infection. We always, any infection is coming, the main signs and symptoms, you can see the low grade fever, voice changing, will be, tension will be there, and then concentration will be less, and sometimes it may lead to the air obstruction. Head and neck cancer. In India, 30 to 40% of the Indians are getting the head and neck cancer. What about the Western country? Western country only 4 to 5%, while mainly using the tobacco. They are using the tobacco. So this is about the problem. Lower respiratory tract. Before that, we will see about the another congenital, the contagious disease is called pertussis. Pertussis is a very much contagious disease which is caused by the Portidella pertussis. There is a peculiar kind of a cough you can identify. That's a whooping cough. It is really a communicable disease. Mostly it obstructs the glottis. So there is a breathing disease, very contagious. Why it is telling very contagious? Especially it will be spread among the community, especially the children who are exchanging the pencils. They put in their mouth and they will be exchanging it. Understand? Then the lower respiratory problem, once the upper respiratory problem not get resolved, it will end up into the lower respiratory problem. The first one, it will be from the acute bronchitis, like mainly pollution, infections, dust, chemicals. Sometimes it is also hereditary. So this acute bronchitis may be lead to the asthma. So this asthma is the mainly for the what is the main signs and symptoms? You can see the asthma, mucus secretion, purulent screen, sputum will be there, crackle, wheeze sound will be there when they are during the physical examination. The mainly chest X-rays you can do. And if all these diseases, the main important and very pathetic one is called anemia. Okay, so now you have to, this is the hints only you are taking. If it is coming as a 5 mark question, nasal disorder, you have to write. What you have to include? Signs and symptom, lightly I told, signs and symptom, diagnosis and nursing management, medical management. Always you have to add the alternative therapies. So you see every module now we are including Ayush. For this one, commonly you can do pranayama, you can tell, or the breathing exercise, deep breathing exercise, and another asanas you can tell them, or you can use the spirometry. I have given even a COVID time for my parents spirometry. This will be like a toy. They will blow the air, lung expansion will be happening. So they are very interested, curiosity in there. Visually they can see whether the ball is going up or not while blowing the air. So then asthma is a separate question they will be asking. So anything, any of the diseases what we are going to discuss, you have to remember the some nursing diagnosis. So always don't write altered, you can write the impaired airway, impaired breathing, impaired gas exchange, anxiety, rather before writing the nutritional assessment. Here we are not going to write a pain. The main thing is the airway is the problem. Altered is take it and you write it as a impaired. Then pneumonia is a single question may come as what is pneumonia. First you define pneumonia. Mainly pneumonia is caused by the bacterial and viral. Okay, mainly it is by the community acquired pneumonia or the hospital acquired pneumonia. Hospital acquired pneumonia is nothing but the this pneumonia is called the nosocomial disease when the or the hospital acquired infection you can say. And the aspiration pneumonia. Aspiration pneumonia is an abnormal entry of some of the metals into this one. This hospital acquired pneumonia, multi-drug resistance will be there, and already patient's immune power is very less. So you need to start with the correct antibiotic, finding out the which organism sensitization you have to check, and the specific antibiotics has to be given. And this nursing diagnosis is very important. The supportive therapies and all these things you have to give. So pneumonia alone, if it is coming a important question, you have to write it. What is the definition, types, and this one. And very important one is the complications of anemia. Atelectasis is nothing but the collapse of the lungs and the pleurisy. Collapse may become either there is a pleural effusion leads to the correct, or the bacteremia lead to the lung collapse, or the alveoli or the portal hypertension like pulmonary hypertension also may lead to the collapse, and bacteremia and also the pneumothorax. So these are all the main complications of the pneumonia. And as I told you, commonly you can remember this nursing diagnosis, anywhere you can apply it. So only these diseases are affecting the respiratory system. This is only will be coming? No, there are other diseases will be coming. First one disease, if you tell, first disease is called the TB, lung cancer. TB separately I will put you how you have to study the TB. One disease I will discuss about the TB. TB is a many million every year. This WHO and government is making a many measures to control the TB to the DOTS program. So in other diseases, the TB is an important one, and also the lung cancer is a very very common because of the air pollution. 2.2 million cases are coming. These lung cancers are different types: squamous cell carcinoma, adenocarcinoma. They are telling that undifferential carcinoma, slow process, and the small cell lung cancers also. So slow growing and fast growing. What is happening, especially in the lungs and the rectum, the highly vascular they are. So you cannot find out in the first stage. It may be like a differentially it mean be diagnosed. By the time the patient is coming, either the rectal cancer or the lung cancer, highly vascular, in the fourth stage they are coming. That is the reason the prognosis is very poor in the lung cancer. So lung cancer alone may be coming as a 5-mark question. You have to write what is the definition. Definition of the cancer, you write it. There is abnormal proliferation of immature cells in the lungs is called the lung cancer. So according to the cells, the lung cancers are classified into like that: small cell carcinoma, adenocarcinoma, and differential carcinoma. What are all the signs and symptoms? You have to write what are all the signs and symptoms. The common signs and symptoms: like obstruction, breathing difficulty, pain. Understand? Then these are all the things you have to write. Next is a fractured ribs is one of the problem. Why the fractured ribs is related to the respiratory problem? Because fractured ribs is going to injure the lungs. So what is the complication will happen? There is a embolism also may happen. The fractured ribs, there is a like blood or the emboli may be entering into the lungs. Also this one, and pneumothorax is a very big problem, air entry into the pleural cavity. And then another important one currently we can see is the interstitial lung diseases. It may cause, we do not know what is the causes, maybe idiopathic, spontaneously it is coming. I know hydrogenic, maybe tension or the hemothorax. This interstitial lung disease, sometimes they are telling due to the DOW. They are also causing lung diseases. So only these many diseases, this interstitial lung disease alone will be coming as a 5-mark question. You have to learn it. And what is the other diseases? Like the other diseases, you see idiopathic pulmonary fibrosis and pulmonary edema and the pulmonary embolism. It's a blockage of pulmonary artery by the air, fat or tumor. Many things, pulmonary embolism may happen due to the fracture also, it may happen. Asthma, as I told you, and COPD, chronic obstructive pulmonary diseases, and cystic fibrosis, bronchiectasis. Bronchiectasis. This is a bronchial wall effect. So any diseases, you just remember ITIS is the infection. You have to remember that. And commonly you have to write the definition of the disease and then the prevalence or the incident rate of the disease, and you have to write the pathophysiology, how the organism entering and other thing. I will discuss in the one topic, I will discuss in the respiratory system in the next video, so that you will clearly understand how you have to write the pathophysiology. And about the X-ray diagnosis, how most commonly RBGL, arterial blood gas analysis, or X-ray is the most common one. And then the drug, always you can write, or anything you can give the antibiotics, right? And then always you must, as I told you in beginning of my session, you have to add the nutritional therapy as well as the natural therapy, indigenous medicine or complementary alternative medicine is then along with the allopathic medicine. Our government is currently promoting, because this Ayush is developed in India. It is being recognized by the foreign countries. They are implementing, we are not implementing. So every primary healthcare center Ayush been implemented. So it is a choice. By this one, along with the allopathy, you have to give freedom to the people to use it. That's why it has been implemented. So you got an idea about first how you have to learn the respiratory problems in medical surgical nursing. First you have to review the anatomy. From the anatomy you draw the structure and you make a mental diagram what all the diseases will come, and you have conceptualized, in this question is coming how I will elaborate it. So most common formulatic, this one you have to remember what is the diagnostic, this one, and common nursing diagnosis, this common complications what may occur, like this, then you can easily remember about this one. So what you have to do, every system you have to make this one, review the anatomy, take one paper and write what all the important diseases will be coming, common nursing diagnosis, and this one, and you can if the question is coming, you can make a synopsis. If it is a 15-mark question, definition, pathophysiology, incident, signs and symptoms, and like that, and then with that you can easily cope up with the medical surgical nursing subject, since it is like a ocean, very deep one. Thank you.